So here's an example of developing the mock-up. I would sit there with our Peds instructor and say, what do you need to solve the problem of students being able to watch babies develop? Well, I would like to create something where I could organize the videos easily, where we could look at each month. So we have filmed a baby in every month of their first year of growth doing these functional movements that now every instructor will be able to utilize. So I'm going to look at the baby in supine, look at upper extremity, and I can actually shift from month to month to show videos and pictures of how these babies change. This is going to change how we teach Peds. Right, so here's one of our babies. All in the palm of your hand. The instructors will be able to just pull this up on their screen and talk about it. In the last 2 weeks, we have wireframed Prosthetics Pro. Right? We've started to think about how could we do prosthetics class better. We did Splinting Pro. An occupational therapy professor and I are working on an amazing splinting app that we're beginning to work on. Neurologic movement analysis. Now we're filming all of these neuro patients so that instructors will be able and students will be able to look at all of this movement dysfunction so we can have conversations about how to intervene. So we're filming a bunch of these. So you can see this is just part of the wireframe that came out of a collaboration with Dr. Tina Stokman out of Marquette. She has a lot of video that she has releases for that we can use to show students how this really happens in real life with the really acute patients. Okay, so here's another example of the wireframing experience. So I'm here with the team, and we are about to build a dance movement screening app for the world. I'm here with Dr. Karam, Annette Karam, soon to be Dr. Tracy Moore, and we are going to rock and roll. So this is how it's done. We always work with the end in mind. You can see I've been building a bunch of apps in the last few days, and we are going to use this template. So I'm going to create a template here. So you can see, and we start adding things. So we start imagining, oh, okay, 3D view. We want to do a 3D view. Then we go to functional tests. We do saute. And here is the saute test. So you have your dance movements that we're filming. And then we move on into the range of motion and so that's just to give you a glimpse. We would sit there for a couple hours and wireframe it because it allows me to begin to get a sense, can I build that, for one, based on what she needs for her teaching, and two, what kind of, by the time we're done wireframing it, I have a spreadsheet of every single video that I need to film, right? So I can show you the same thing we're doing for our neuro apps. Here are our patients, here are the movements that we're going to film, and we are checking the boxes. Every video, we check them off, okay? Here are all the different patients that we want to film or the different impairments.